Namaskar, I'm Ashok Vyas, and today's show is always going to be very special because today we are talking about the movement which keeps us healthy, which makes us wise. And many thinkers have always eulogized the importance of walking. There were some essayists who claimed to be on a meditative zone while walking. But in order to walk we need to have fitness in our feet, and how we are paying attention to this important organ of our body which is helping us stand and move. I have a young podiatrist joining me from Virginia Beach to share about feet fitness. Dr. Shruti Vyas, welcome. Namaste.
Thank you. Namaste.
How are you?
I'm wonderful. How are you?
Very, very nice. So, talk to me. What do you learn as a podiatrist, which a general medical practitioner is not learning, and that is the specialization which makes this podiatry.
So, as a podiatrist, there are four things that we focus on when a patient walks in the room in terms of your feet. So, the first thing is dermatology. So, we check the patient's foot, make sure that there's no fungus or ulcers or warts, things like that. The second thing we check is pulses. So, vascular, we make sure the pulses are proper. There's capillary refill to the toes. The third thing we check is neurovascular nerves. So we check for to make sure all the nerves are intact. And then the fourth thing we check is musculoskeletal to make sure that there is no pain in the joints or pain in certain muscle groups or fascia or tendons, things like that.
Wonderful. So, Dr. Vyas, if I say for a layman, it is very impressive when they hear terms that they feel are relevant to the subject, yet they don't understand them wholly. So, let us go one by one. You mentioned 4 points. What was the first one?
The dermatology, so
Dermat.
skin
That is
essentially.
skin. Yes, yes. So, how you see that relevant as far as fitness of feet is concerned?
So, a lot of people have started going to the gym January 1st because we're all on this fitness journey, the 1st of January. And some people have probably already stepped off the treadmill, and some people are probably still there. So, the ones that are still there, using athletic gyms and locker rooms and showers, you can develop warts quite easily. And warts are viruses, and they can transfer from skin to skin, and they can transfer from surface to skin as well. So those are tricky and hard to get rid of. So that's one of the first things that we look for when a patient who's trying to stay active comes in for derm. And there's various different things that we do to treat that as well. There's in-office procedures and things that we recommend outside the office. And then other areas for other patients that we see a lot is diabetic patients. They have ulcers. We make sure the ulcers are healing. We make sure they're not infected. We make sure there's proper circulation to get the ulcer to heal up. Anytime there's a wound that's open for a long period of time, you've exposed it to bacteria, you've exposed it to outside organisms that can enter your body that aren't supposed to enter your body. So those are things that we take care of, derm.
Okay, so coming back to the reasons why sometimes there is a skin related disease that comes up because everybody is taking shower. Everybody, most of us are using socks and having shoes and all that. So, is there something that sometimes we end up doing differently than what we should be doing, which results into this problem?
So, one of the most important things is to check your feet daily. Now, I know this sounds very easy, and you're like, wow, what is she talking about? But really, a lot of people don't check their feet daily. Can you tell me when the last time you checked between your toes was? Can you tell me today you checked between your toes and there's nothing in there? I don't know if you can, and I bet after this episode you're gonna go and check between your toes. So a lot of people don't, and the hard part is when a diabetic patient or an immunocompromised patient doesn't do so, they have loss, some of them have loss of vascularity, some of them have loss of nerves. They can't sense if there's something growing between their toes or under their toes or things like that. So it's very important to check your feet daily.
So check your feet daily, wash wash properly. I say with lot of smile. And any other regular tip that you would like to extend from this angle for our viewers?
In terms of dermatology, check your feet after you wash your feet, after you take a shower. Make sure that you clean between your toes. Make sure that the in between of your toes is completely dry. Um, that's the main thing. More than likely, you won't have anything, but it's still good to check and make sure that there isn't anything there.
So it is good to reassure yourself, even if everything is fine, then you can pat your back and you say, I'm taking good care of my feet. Yes. So, what was the next point in the series of four major areas?
The next one is vascularities that we check for. So vascularity, we check for pulses, make sure that the pulses are good in your toes. We check for capillary refill. So basically, if you pinch yourself and the color comes back, that means that there's proper capillary refill. We check to make sure there's hair growth in your toes. That tells us there's proper circulation, things like that. Again, a lot of the times when you are diabetic or uncontrolled, and or if you've been smoking cigarettes for a long period of time, or you have any kind of peripheral vascular disease, that can result in slower or decreased circulation to your toes. So the way I always explain it to my patients is check out grass. Anytime you water the grass will grow. But if there's no water, then the grass won't grow. So same concept here. The if the water or the blood is not getting to your feet, then that those tissues will die. So you want to make sure that they're coming there.
So now this is something which is above the feet that is affecting the feet. So now let us try and understand from you what might be the cause that would prevent the flow of blood to the feet. So, and as a layman, if I may add, one would think it should be it should be flowing whatever, because you are not doing to make it flow. So if you are not doing anything to stop it from flowing, then it should flow. Why it is not flowing?
Well, a lot of people don't know what they're doing to stop it from flowing. So one of the most important things is you want to make sure you're not smoking cigarettes, you're eating healthy, eating a lot of a lot of oils, a lot of cholesterol. Those can clog up your arteries, and in that instance, what we do is we refer to vascular surgery, and they are able to help us in opening up the vessels that are in the lower extremity and help to increase the blood circulation to your feet. So just living a healthy lifestyle is the most important thing.
And most easy and most difficult thing is to have a healthy lifestyle. And if I
Yeah.
may, if I may relate from Bhagavad Gita, where they say that the one who sleeps moderately, eats moderately, is a yogi. Now we think that it's simple, but we don't. Sometimes we don't sleep in the proper measure. You also mentioned about diabetes. Probably now is the time to understand how. I mean, again, as a layman, I consider diabetes to have relationship with sugar level.
Yeah.
Now, how that fit, fitness of my feet would have relationship with my being diabetic is difficult to comprehend.
So when you're diabetic, you have a lot of sugar, like you said, in your body. Whenever there's a lot of sugar in your body, that can affect a lot of different things, including your nerves and your vessels. So your vessels can become thick with the excess sugar in your body can create thicker vessels. So when the blood is circulating, vessels have to pump, but since they're thick, they're not able to. Okay. A lot of the times when they mess around with the walls of the vessels, circulation can't come to your feet properly. So that's an issue. Increased glucose in your body can also disrupt the nerves. So our body has a constant, what do you call it? Just like a base level, baseline. And having too much sugar can affect that baseline. So one analogy I always give is When you give a little kid a lot of sugar, that kid will go and jump and run and do all that stuff. So same thing with our sugars. When people develop neuropathy from excess sugar in their bloodstream, it's because those nerves start spazzing out.
So, of course, diabetes is something which requires overall attention on several aspects of what are you eating and what are your day-to-day habits in terms of exercising, etc. That much most of the laymen who have access to Google know know about. So let us move forward, focusing on the fitness of feet with you. What was the third point you mentioned that comes
That was
under the body?
nerves. So, one of the two of the top reasons why get neuropathy or your nerves are damaged. The first one um, is diabetes, and then the second one is alcoholism. So, a lot, like we said, we want to have baseline. You don't want too much sugar, too much alcohol, all that stuff. So, if you do all of that, alcoholism can affect the nerves in your feet. It can kill those nerves as well. So, that's a big one. That's what we look out for.
So looks like we are talking about fitness of feet, and it is resulting into us behaving in a ideal fashion, which every time you hear. And this is for a layman, it's like a cliched thing. You go to the doctor, and even if you don't go to the doctor, whatever is the problem, they say, "Oh, do you drink? Do you smoke?" And they say, "Don't, don't do it." So, so let us get a little bit below the surface and how alcohol is affecting the health of your feet also, because normally, I mean, sincerely speaking, we hear that people cannot think clearly if they are under the influence of alcohol. But
Hmm.
feet also, I mean, of course, they sometimes wobble, they don't walk properly,
No, not that.
but that's a different thing. So yeah, if you can explain a little bit.
Sure. So if there is excess alcohol in someone's body, that can affect your nerves. So alcohol, like we use for wounds, right? You use to clean surfaces. You use to kill germs and kill things. So there are bacteria in our body as well, and that's good bacteria that's allowing us to live. If you ingest too much, it's gonna kill all of that. It's gonna not allow nutrients to go to the nerves, so it starts killing the nerves as well. So it's a whole variety of things that excess alcohol consumption can do.
So, as a podiatrist, you also operate your patients. We will talk about that, but there was one more fourth point that you mentioned in the beginning of our conversation. What was that?
That the last one was musculoskeletal, so any issues to do with the muscles, the bones, the joints, in the fascia, the ligaments, tendons in your feet.
So now let me take a scenario where somebody has always practiced running and they made use of the treadmill a lot. So I heard from few friends they end up having some problem in their knees. Is there something that they could have done differently to prevent this situation?
So running is a sport where you're moving your joints a lot in your knees and your feet, and you end up developing arthritis when there's too much movement of the two bones. So that's what's happening to the knee. Unfortunately, there is synovial fluid that's between the two bones. Unfortunately, that fluid um, goes away. Okay, so if you do too much of this, it will deteriorate, and then the two bones will start rubbing against each other and creating more inflammation and pain, stuff like that.
So that is the situation, and there are few common problems which may directly or indirectly relate to feet, and one of them is without giving away my age, I would say that many people, as they grow, they find themselves getting up in the middle of night because of cramps.
Yes.
It could happen to anybody at any age, but what do you think is the cause for having cramps? And I will also add two lines. Those who have experienced it is a very very unsettling experience. You cannot move your feet properly, and probably there is some muscular kind of entanglement that results into lack of flow in the movement of your feet. So talk to us about that.
So there's various different reasons why you can have cramping in your leg or in the back of your leg. So your calf muscle could be cramping because you have vitamin deficiency or you have some kind of an issue with the veins in the back. Now, if it is something to do with the veins, that is actually an emergency, and you really should go to the emergency room for that. That's called a DVT, deep vein thrombosis, and that's a clot in the back of your leg. Now, the previous what you were talking about, like feeling like you can't move. Sometimes you can also develop uh, buildup of lactic acid in the back of your camp. So sometimes when patients start to walk a little bit more than usual, or they're doing more exercise that they're normally not used to, that can result in buildup of lactic acid, and it can result in having that that sense of not being able to move.
So now some general tips. Let us begin. There is no problem, and somebody is sitting with you for regular checkup, and you share some tips as to what are the practices that would prevent them from having any need to go to a podiatrist.
The basic one is checking your feet every day. Stretching is another big one. Stretching your Achilles tendon is very important. I always make a joke saying if everybody stretched their Achilles tendon every day, then I would be out of a job. So that's one of the major ones. Wearing the right type of shoes, making sure you're wearing shoes that are good for your type of feet. That's important. If you're having any kind of foot problems, it's a good idea to go see your podiatrist. You may require orthotics if you're having foot trouble or foot pain as well. So those are
Okay,
the
so
main
there are some right type of questions. Like this question, you said have the right type of shoes.
ones.
Now, whatever is available in the market, I can I can only have that shoes. I'm not going to have sort of a custom built shoes for me. So anything that you can add to sort of give us more clarity on this.
So shoes normally that have a good support in your arches and in your heels, or they tend to be just as a rule of thumb, they tend to be good for your feet. So a lot of people I see walking around, walking for miles in flip flops, or walking for miles in flats or heels or unsupportive shoes. That's not a very smart decision. So just rule of thumb, wear something with support in your arch.
And also, you talked about cleanliness, and some people don't believe in washing their socks. So I say it in a lighter vein, but that might also result into some problem because of the perspiration and all that. Is
Yeah.
there?
Absolutely, yeah. Changing your socks every day, that's also something huge. I thought a lot of the things that when I came into practice I thought everybody knew, and I realized not everybody does those things. So changing socks, washing your socks after you've worn them once. If you do have increased perspiration in your feet, there are certain medicines you can get to decrease the perspiration, or use you know how we use deodorant under our armpits and stuff. You can use that for your feet as well if you're having excess perspiration.
So nowadays, call it a fashion, or everybody hears that, oh, you should walk 10,000 steps
Steps.
every day. Now, my question is not related to how you feel or like on a weight loss regime or whatever, but mm, walking more is good for the feet, or not walking is good for the feet, or it is irrelevant.
Well, if you walk more, then you lose weight, which means your feet are carrying less pounds, so they're doing less work. So
And you have also been at a stage where you had, unfortunately, to amputate some of your patients. What is it that uh, causes someone to reach to that dangerous stage that there is no other alternative? If you give us one example.
Sure. So getting to that point takes a long time. A long It takes a long time and a lot of neglecting your health. So, if you just start at the beginning and continue monitoring your health and your feet, then you won't get to that stage. But when I say neglecting your health, I mean remember the four things that we talked about earlier, especially vascular and neurological. Those two, as soon as you find out that they're being diminished, you should really do something about it. So last week, I had a patient who has been smoking a pack a day for 20 years. He drinks beer every single day, and he's diabetic. And he is going to lose his leg because he has really, really bad circulation. There were a lot of surgeries that were done to try to prevent this for this patient. The vascular surgery department tried to open up the vessels that were in his lower extremity, but they weren't able to. There's also a procedure called angioplasty that was done, but it was unsuccessful. So his foot actually started dying. It became black. The tissues in his toes became black. There was bacteria building up in that foot. And the best possible um, lifestyle that we could offer him was amputating his leg. And the reason for that is because his leg, right below his knee, was where the vessels were going. Below that point, there was no more circulation. There was no blood going to that leg. And so it was a tough decision, especially because you become invested in your patients and you become sort of friends and family. So we had to come to that tough decision last week.
So emotions are important. Being sensitive is important, but then being clear pragmatically as to what would serve in the long term to the patient is also important. Uh, Look at your journey, and as we move towards the concluding part, let me go to the beginning of the journey of any physician. So there are days when you are a student in college, you are learning. Of course, you are paying attention, yet it is not directly related to someone's life. The way it becomes once you start practicing, and there is another stage of residency, and so if you look back, how much of it is the classroom setting that is helpful, how much is of it is the practical on the job learning as a resident, that is so I take your permission to add one more thing. I think it is a sense of inquisitiveness which is different in different individuals. So that applies for physicians also. So being on your toes constantly, and you have these CMEs. So you keep learning, and from here comes the question: is there anything new that you see is emerging in the field of podiatry?
Not necessarily in the field of podiatry, but there's always new gadgets, new information for how to help our patients better in terms of, let's say, wound care products or grafts, or when we're doing surgery to fix fractures or bunions. There's always new, plates or staples or screws that come about. So it really is. It's a constant learning. That's why they always say doctors are always practicing. You're never perfected. So
So I'm
that's
also
the fun part.
yeah, absolutely. I'm also practicing the art of questioning to extract more knowledge for me and my viewers. And as we conclude, would you be kind enough to repeat some top three tips that you would have for anyone or your patients as far as fitness of feet is concerned?
Okay. Well, the first one would be to stretch daily. Make sure you stretch your Achilles tendon every day. Number two, change your socks daily. And when I say change your socks, don't just put on a sock, put it on the side, and then wear it again. Wear a new sock.
Okay, meaning wash it, wash it.
Wash it, yeah. And number three, if you're going to be healthy and active and be walking on your feet a lot, wear supportive shoes. Wear shoes that support your arch. Wear shoes that support your heels. Very
So thank you very much. On that note, we need to be vigilant, not just for our mind, but for our feet also, that is the key advice. Talking to a podiatrist, we probably get. So, thank you very much for joining us, Dr. Shruti,
Thank you for having me.
with lots of good wishes for all our viewers to have healthy walks
Yes.
every day. This is Ashok Vyas. Namaste.